Hello friends, I am from Helping Hand MBBS and today we will discuss the anticholinergics. This is the second part of a parasympathetic nervous system. I have already made the video of parasympathomimetics and you can see that. So now today we will discuss the anticholinergics. So in anticholinergics we give the drugs which block the cholinergic receptors. So cholinergic receptors were of two type, nicotinic receptor and muscarinic receptor. In nicotinic receptor there are two types, that is NN type and NN type. I already told you NN type are present on the ganglia, autonomic ganglia. So by inhibition of autonomic ganglia we decreases the sympathetic as well as parasympathetic nervous system, due to which there is a postural hypotension. The sympathetic drive is completely gone, which cause the hypotension. So if we give the NN blockers, it will cause the hypotension. The various drugs which causes the hypotensions are tetraethylammonium, trimethophan and mecamylamine. So these three drugs are very important. You should know these three drugs. Then what are the NM blockers? The NM blockers are skeletal muscle relaxants and we will discuss them in separate video. I will definitely make a video about this. So today we are going to discuss the rest of the muscarinic receptors. Muscarinic receptor we will discuss organ wise. It will be very easy to remember and let's see them. So first of all, CNS. In CNS, the muscarinic blockers cause decrease in cognition, due to which the person is not aware of the surroundings and the thinking ability of the person is gone. So it is used as a used in narcoanalysis. That is, in when there is a thief, we give the scopolamine drug which causes the decreased thinking power and he cannot lie. So for narcoanalysis we give the scopolamine. Then in oropharyngeal secretions or glands, the muscarinic blocker cause decrease in secretion. Due to this there is a decreased secretion of saliva and the various other secretion in the esophagus and as well as the pharynx part. So it is used as a pre-anesthetic medication. We know in anesthesia the muscles or the ciliary function is gone. So to prevent the aspiration in the lung, we give the muscarinic blocker. So there is a decreased secretion, so there is decreased chance of aspiration. So there, to decrease the aspiration chance, we give the glycopyrrolate as a drug. Glycopyrrolate here. So it is used as a pre-anesthetic medication, that before anesthesia we give this medication to decrease the secretion, so that there should be no aspiration of saliva etc. in the lungs. So in lungs, what it will cause is, muscarinic blockers cause bronchodilation. Normally the cholinergics cause bronchoconstriction. Here the anti-muscarinic cause bronchodilation, so we can use them in asthma as well as COPD. The main drugs, very important drugs, are ipratropium and tiotropium. You should know that ipratropium is short acting, whereas tiotropium is a long acting drug. And another very important point is that tiotropium is a drug of choice for the COPD, chronic obstructive pulmonary disease. Tiotropium is long acting and ipratropium is short acting. Tiotropium is drug of choice for the COPD. The next part is pupils. In pupils there are two functions of anticholinergics. First is mydriasis. First is mydriasis and the second is cycloplasia. What is mydriasis? Mydriasis is the dilation of pupil, due to which we can see the fundus of retina very clearly. So it is used in fundoscopy. And what is cycloplasia? It is the paralysis of ciliary muscle. So now the lens of the eye will not move and there will be no accommodation power. So we can easily test the refractive error. Refractive error testing can be done, and the fundoscopy can be done by the anti-muscarinics, because they cause mydriasis and the cycloplasia. It is very important. The main drug are tropicamide and atropine. The main point about them is tropicamide is used in adults and atropine is used in children. You should know that the ciliary muscles of children are very strong, so we need a anti-muscarinic drug which is very strong, that is atropine. Atropine is stronger than the tropicamide. So in children, to cause the cycloplasia, we should give a strong drug, that is atropine. Whereas in adults, the ciliary muscles are not so strong, so we can give tropicamide. So tropicamide is given in adults and atropine is given in children. It is very important question. You should remember this. Then in heart, we all know that parasympathetic decrease. So anti-parasympathetic, that is anti-muscarinic, will increase the heart rate. they will increase the heart rate and increase the conduction, and used in, so they are used in bradyarrhythmia, that is decreased heart rate. So if we give the antimuscarinic like atropine, it will increase the heart rate. Now GIT, the sixth organ. In GIT there can be decreased secretions or there can be decreased contraction. We know that secretion are through M1 receptor and contraction is through M3 receptor. So we can give M1 blocker or M3 blocker. In M1 blocker there is wait a minute. In M1 blocker there are pyrenzepine and the telenzepine. Sorry for the color, but you should remember that there is M1 blocker decreasing the secretion, and the drugs are pyrenzepine and the telenzepine, and the other drugs are for decreasing contraction. The use, first of all we should know that if there is decrease in secretion, why will we decrease the secretion? So it is decreased in cases of peptic ulcer diseases. We decrease the secretion in peptic ulcer disease where there is increased HCl secretion. Also when will we give the M3 blocker which decreases the contraction? In cases of vomiting, there is increased contraction in the upper GI tract. So we give the M3 blocker like glycopyrrolate or scopolamine. They will decrease the contraction and used as an antiemetic. Here the use was peptic ulcer disease which is caused by increased HCl secretion, and here this is antiemetic. Now seventh and the last organ for this video and in anticholinergic topic is bladder, urinary bladder. So what are the various drugs in urinary bladder? First of all we should see the effect of the anticholinergic. They decreases the contraction and the urination. They decrease the contraction of detrusor muscle and increase the contraction of the sphincter so that there is no urination. So we use them in overactive bladder where the activity of bladder is very high. So we give the drugs like, there is a mnemonic, you can see that SOFT, the soft. From S the drug is solifenacin, from O there is oxybutynine, from F there is flavoxate, and from T there is tolterodine. And another very important drug you should remember is derifenacin. Derifenacin and solifenacin are very selective drugs, the rest are non-selective. So derifenacin is drug of choice for the overactive bladder. So this is all about anticholinergic, guys, and if you enjoyed this video, please like the video and subscribe our channel. Thank you for watching this video.